Hello, everyone. We want to give you a moment to finish up your polling, and we're going to take that down in a second. I'd like to welcome you all today to our webinar, and we're going to be talking today about the role of intermediary organizations in terms of building infrastructure and supporting the implementation and dissemination of evidence-based practices. This is part of our ongoing evidence-based practice series. Can I please have the first slide back? Let's see here. Great. I'm here with my colleagues, Sue Kearns, Jesse Watrous, and Jill Farrell. I'm going to be talking to you today a bit about the role of intermediary organizations, and we're going to dive right in and get started. Let's go ahead and share those poll results for the folks who have had to vote so far. So it looks like about a third of the folks who had a chance to respond had worked with an intermediary before. About a third hadn't, and some of you aren't sure whether or not you have. It looks like for those of you that are interested in some of the roles of intermediaries, that best practice model development is the area that you might find the most useful to you. And then that's closely trailed by continuous quality improvement and outcome evaluation and training. When you think about the areas that could be the most challenging, it looks like policy and systems development can be the most challenging. So we're gonna dive into that a little bit as we talk about intermediaries, and I'm gonna go ahead and get started. So let's see. Let's start by doing some definitions. So first of all, I'm Bob Franks. I'm the president and CEO of the Judge Baker Children's Center. I've been working throughout my career in the implementation and dissemination of evidence-based practice. Have developed two intermediary organizations over the years, one in Connecticut, what was formerly known as the Center for Effective Practice in Connecticut, and now at the Judge Baker Children's Center through our Quality Care Initiative. And way back before purveyors and intermediaries had a name, we used to think about the idea of spreading best practice more broadly through dissemination and implementation activities. And back during that time, we really began to see the first purveyor organizations, and those organizations were groups that were around trying to disseminate and implement a specific evidence-based practice. And a really great example of that is MST Services that has worked for years in terms of disseminating the evidence-based practice multi-systemic therapy across the United States and around the world. Intermediary organizations grew a little after the first purveyor organizations, and they tended to be organizations that had a bit of a broader role. They may take on the role of a purveyor, but they may also be involved in some of the other activities that we were just looking at, things like providing training and technical assistance, working in best practice model development, providing evaluation of services, and also looking at best practice model development for emerging practices, as well as policy development. So intermediary organizations were seen as having a bit of a broader role. I remember many years ago, I was at one of the first convenings of the Global Implementation Conference, and there was a bunch of us that were kind of lumped together in intermediary and purveyor organizations, and we were really kind of struggling with some identity. And it was at that conference that the idea was launched, hey, why doesn't somebody take a look at the role of these organizations and what they do? And I realized during that time that I volunteered myself to actually do some of that descriptive research. And so I'm going to present to you in a little bit about what I found and what some of the things that intermediaries and purveyors can do to help you in your jurisdiction help disseminate and implement evidence-based practice. And I love this cartoon. I use it in lots of different trainings and presentations. My colleague Jason Lang uncovered this initially. He's now at CHDI. And I think it's just great when Dilbert gets back from the training, he's got his big binder. The training's forgotten, but it's a living monument to temporary knowledge. And this is why we need intermediary organizations, because historically, a lot of our traditional trainings that we would attend in the human services field would kind of end up as binders on a shelf, and they wouldn't be implemented or sustained with fidelity over time. So intermediaries are those organizations that really bridge that gap between our knowledge and between practice. And we often work between two entities. It might be between a state system or a funder and provider organizations. It might be between a treatment developer or a researcher and the provider practice community. We might be training, working with a large state or federal system, and then working with local systems to implement a best practice. So it's the idea of bridging this gap between knowledge and practice and acting in that in-between space. One of the things that most of us know is that this is not easy to do, and it requires a special skill set. And so intermediaries are organizations that really have developed those skills to help bridge that gap and help address the challenges and barriers that folks that are in the trenches and in the field face. In particular, they can really work to help facilitate the implementation of a promising best or evidence-based practice that can lead to sustained changes at the policy level, at the systems level, and most importantly, at the practice level. And really, what we try to do is really think about how to create that sustainable change over time. So back in 2015, my former colleague, Chris Borey, and I did some research, and we surveyed over 70 purveyor and intermediary organizations from around the world. And we found some really interesting results. One of the things that sort of stands out to me is when we asked them about barriers to successful implementation that they faced in working with a whole wide range of constituents around the world. These are the three that bubbled to the top. So the first one was really the availability of having adequate funding. The next was, and the capacity in the organization. The next is really looking at, is the organization ready for change? And then third, is there sufficient buy-in for change? And I'm going to talk a little bit about how we can address those three different areas. So what we found was I went into the research with a bit of a hypothesis based upon the roles of the intermediary that we had developed at the Center for Effective Practice. And what we found was a lot of support for these 7 roles of intermediaries as they're doing this work in supporting the successful implementation of evidence-based practice and creating sustainable change. And you could see that these roles vary all around this same concept of bridging the gap between knowledge and practice. So most basically, an intermediary can act as a purveyor of an evidence-based practice, working with a treatment developer, working with an expert trainer to bring a practice to scale. When I was working in Connecticut, we did this with lots of different practices, most notably trauma-focused cognitive behavioral therapy. We did it with early childhood practices. We did it, and we worked really across multiple systems, and really thought about over time how to develop the appropriate mechanisms to make that work. We provided consultation and technical assistance to agencies, helping them solve problems, helping them address challenges they might face, barriers to systems change or implementation of best practices, helping them with structural issues, and then a variety of other concerns, data, infrastructure issues, technology issues. Providing quality improvement to look at whether or not services are being delivered with quality and fidelity to the model. Looking at research and evaluation of, are the services working? Engaging in model development for fledgling best practices, or helping to operationalize a practice by developing a manual or implementation structure. Working at the policy and systems level to help develop systems and policies that support best practices and can sustain them over time. And then finally, raising awareness about the value of such programs. And when we did our research, we actually found a lot of support for these functions, but we asked the questions about what was your sort of main function when you got involved in being an intermediary or purveyor organization. What was the core activity that you initially engaged in? And interestingly, on the front end, many of you talked about consultation and technical assistance being something that you found the most useful. And you can see that that's really a core activity of intermediaries. And a lot of intermediary organizations actually got started doing consultation and technical assistance activities. And the second biggest one is a purveyor of an evidence-based practice. So those two core activities really made up one of the main features of what intermediaries do. The other thing worth noting is that intermediaries work across multiple systems. And so, you know, we actually are sometimes working across systems, within systems, or connecting systems, including things like behavioral health, child welfare, early childhood, juvenile justice, and others. So we're going to look a little bit around specifically what intermediaries do and how they can facilitate the active implementation of evidence-based practice within a system of care. And to do that, I'm going to borrow from our friends at the National Implementation Research Network, NIRN, and my friend Allison Metz, and look at their frameworks as a way to look at what intermediaries do. So we'll start on the front end with the idea of selecting innovations. And for all of you that are within your systems of care looking at wanting to change practice, perhaps you've written a plan, perhaps you're at the point where you're thinking about what the needs are in your system, and you're really trying to go through that process of saying, what is it that we should do? Intermediaries can play a really important role in really thinking about what are the needs, what is the fit, what is the capacity. Some of our previous webinars went into some detail about that, but sometimes you need some outside help. You need an independent entity to help walk you through those questions. When you really think about needs, there's a whole wide range of needs that you need to consider. Intermediaries can do some research. They can do some environmental scans. They can conduct a needs assessment, and they can work with constituents to be able to better understand the context in which you're trying to create change. In addition, we also look at the concept of readiness. So are you ready to change? And here you'll see sort of the components of one readiness model, which is Abe Wandersman, looking at motivation, general capacity, and innovation-specific capacity. But there's lots of readiness models out there. Intermediaries can play a role in saying, is this organization, is this system ready for change? What do we need to do in order to get it ready to accept change? And are there some organizations that simply aren't ready to engage in a change initiative? We tend to use readiness assessment when we work with organizations to really, determine what their strengths and relative challenges are and how we can tailor the implementation process to meet those needs. Really looking at whether or not they have the capacity to implement a new practice, whether or not they have the qualifications, and then are they motivated? Do they have the capacity within their organization? And do they have the capacity to deliver that specific evidence-based practice? So for example, if they're delivering a trauma-focused evidence-based practice, are they a trauma-informed agency that has the sufficient expertise to be able to do that? All right. We also know that implementation doesn't happen overnight, so intermediaries can help facilitate a structured process that brings the system through various stages. One really important part of that is this idea of co-creation that actually goes back with our selecting innovations and how we're working together with our local stakeholders to really help create a change initiative that works for everyone and that has everyone's buy-in. And that's a really important role that intermediaries can play. When we think about co-creation, we have to think about the community needs, what those best practices might be, and what the strategies might be. Looking at issues of capacity, and then really working together to identify what the solutions can be. When we think about our implementation stages, at the very early stages of installation, when we're beginning a change initiative, really providing sort of structure, tools, knowledge, and the technical needs and capacities to make that implementation process work. During the implementation process, really thinking about the implementation drivers, which I'll talk about in a minute, how to create a data-informed system, and how to build those necessary supports. One way that we do that, for example, through the initial and full implementation stages is we utilize a learning collaborative approach where we work with multiple agencies in a very structured approach throughout the stages of implementation to facilitate a successful full implementation of the model. And then ultimately, once that model's in place, how it will be sustained, how will we measure its outcomes, how will we monitor fidelity? These are all things that an intermediary can work with a local system to help them do. And then we can look at this idea of implementation drivers. Once again, this is a NERN construct that I think is really helpful in terms of looking at the various components of implementation. And you could really think about intermediaries working around the organizational drivers in terms of building systems, building organizations, building the necessary data support and infrastructure needed to implement a best practice. For skill competency, working with expert trainers in the evidence-based model to think about providing training and coaching in the model, as well as selection of those participating. And then the part that I really enjoy is developing the necessary leadership drivers. And that is, do we have those people in place in the system, and are they giving the adequate support, not only to implement the best practice, but to sustain it over time? So an example of the way that I do that is when we have a large scale systems change initiative. For example, we recently did one in North Carolina. We bring together senior leaders from all the agencies and engage them in a senior leader affinity group. And we work with them really closely to attend to whether or not the organizations and the system at large have the necessary support from senior leadership in the organization to not only implement it, but sustain those practice changes. When we begin to look at how we build competencies and build organizations, when we use an intermediary as opposed to traditional training, we can actually stack a lot more things from our toolbox into trying to ensure a successful implementation. A lot of use of data, entering into a continuous quality improvement process, developing those affinity groups as I described, and providing ongoing consultation throughout the course of the implementation. And our implementation processes, when we're working as an intermediary with a system, usually takes about 12 to 18 months from beginning to end. When we think about those implementation drivers, and we're thinking about, how we are measuring and building competency, sometimes we need to work directly at various levels within the system and address what competencies we need to increase. We might need to develop specific training curricula, coordinate trainings, using lots of multimodal strategies. So sometimes we're doing in-person meetings, we might be doing Zoom consultations, might be doing some one-on-one consultation, and we do a lot of team building where we're trying to train teams to use QI tools, so that they can solve problems for themselves. I always think about our work as an intermediary as providing the scaffolding. It's very akin in my mind to what we think about when we think about human development and early childhood development. When a child receives scaffolding, but then develops the competencies on their own and then becomes independent. Similarly, we're trying to provide some scaffolding for those we're working with the goal of them becoming independent and being able to do this work on their own once we're gone, so that they can sustain it and they won't need to continue to rely on our work as an intermediary. And I already talked about my work with the leadership group. Once again, sometimes it's really helpful to work with leaders and point out what they can do, how important their role is. Something as simple as being attentive to making sure the team has the adequate space and time to be able to engage in their implementation activities or team meetings and support. Being flexible about rules around how services are delivered. For example, if it's a home-based service, then agencies sometimes have to develop some different rules about how employees work, how they check in, whether or not they can do their work remotely or mobilely. Lots of questions to answer, and you need those leadership folks at the table to be able to address and solve those questions. It's not enough just to train people in a new practice. If they don't have the support of their senior leadership, that practice will fail unless they're really looking at it from the agency level. And then moving through, we also can look at the development of implementation teams. And I'm a big believer in the importance of developing implementation teams, both during the implementation process as well as on the ground. So our goal is always to implement and sustain an implementation team within the organization or the agency, and also across the system, so that once again, the work can be sustained over time, that there's some ownership of the work, and that there's some local accountability to make sure that things get done. It's much more powerful coming from a local team than it is from an outside entity. So what I try to do is we try to provide our leadership and our local implementation teams with lots of tools and lots of data, so that they could then feed that back to their teams and engage in local problem solving. And the other way that we can develop local teams is through our use of affinity groups. And I mentioned before the affinity groups that I've developed with senior leaders, which I think could be really helpful and useful. But intermediaries can also provide support around pulling together people that do common roles. So pulling the supervisors in the organization together to say, what are our challenges as supervisors? How do we provide support to our staff? What are the new issues that we need to face when we're trying to supervise this new practice in our agency? And do we have the competency to do that? Thinking about the people on the ground and the challenges they face. What's it like for them? I'm trying to learn this new practice, and I still have my productivity requirements. I'm trying to, think about how to fit what I'm doing into our standardized EMR and case notes. How does that work? And I feel like I don't have enough time to think and plan before my session to ensure that I'm delivering this model with fidelity. Those are all the kinds of questions that might come up in a clinician affinity group, and with the appropriate facilitation can really begin to address those and then bring them back to the whole learning collaborative and group, so that we're making sure that we're addressing them in the implementation process. And we can look at those same types of issues at the organizational level and the community level. The community level, it might be questions like, are we getting referrals? How's child welfare involved in this project? What happens if there is an active case with a caseworker, and how will that person be engaged or informed of progress? Lots of different questions at the systems level. And then finally, and I think in some ways most importantly, a role that an intermediary can play when we're looking through the lens of these implementation frameworks is really thinking about the role of improvement cycles. And I can't say enough over the years that I've been doing this, how much I have come to rely on and see data as my friend. And I know for many of you on this call, for some of you on this call, data may feel a bit like a dirty word and something that you don't enjoy. And we, from the very beginning, even with some of the activities that we work, with sites, we try to help them understand the importance of data and the importance of measurement and how measurement can impact change. So this is something that we do in small ways and in larger ways. When we're confronted with a problem, we try to think as a team about how we can solve it. We provide the teams with tools about how they can monitor and engage in continuous quality improvement. And then we also work with our stakeholders to help them collect the data and analyze it so they can sustain that on their own. When you're working with a smaller provider, they may not have the capacity or expertise to work with data. It might be really foreign to them. Sometimes you're working with a larger agency that might have actually a built-in infrastructure for collecting data and looking at outcomes. So you really have to be flexible in terms of thinking about what the needs of the organization are and how you build that necessary and sufficient capacity. But any organization of any size can use these strategies and use improvement strategies to be able to reach better outcomes. And as an intermediary organization, that's one of the things that we work with organizations to train them to do that in a way that makes sense for them. One of the things that I always tell my team is our goal is not to burden the organizations and the agencies that we work with. Ultimately, our goal is to give them the tools to make their work easier. And it doesn't necessarily always feel easier on the front end, but as we bring them along and we build those internal capacities and they begin to see the value of looking at things like looking at outcome data and looking at fidelity data and collecting metric data, they really begin to see a change and recognize that it can actually improve their work. The other thing that improvement cycles do is they really help solve problems. So we're not getting enough referrals to this new evidence-based practice that we set up. What do we do? Well, we really provide some scaffolding to help organizations sit together and engage in something that's like a plan, do, study, act cycle, where we will ask them to identify what the problem is, come up with an idea, brainstorm, throw things against the wall, kind of decide on the idea that they think they want to try out and makes the most sense, to implement it in a small way and to see what happens. And if it works, maybe to go back and tweak it, maybe to expand it. And then at a certain point, they might say, hey, this is great. We're going to bring this to scale within our agency. And I've seen this work so well time and time again. It's not an overly complicated construct, but it's something that in organizations, particularly human service organizations, we often don't take the time to do. So sometimes when we're confronted with a problem, we try to plow through it. We might get frustrated and get stuck, but we don't take the time to sit down collaboratively as a team where all ideas are equal, not just the idea from the boss in the room or the supervisor, but all ideas are equal. And we can really move things forward. A really great example of this is, we were having some difficulties with some of the intake process in one of our agencies, and it actually was the front desk receptionist that came up with the idea that really facilitated the process, made it easier for families, and ultimately resulted in improved outcomes. So these good ideas can come from anywhere within the team, and it's really important to have a mechanism where we can hear them, we could think about them, we could try them out, and then if they work, to scale them up. And this is a great way to solve problems for agencies, not just around clinical issues, but also more broadly. So that's an example of a way in which an intermediary can help. And one of the things that I really like about this process is that it really spreads over time. And you start with a small issue. You identify some performance goals and ways you can improve it. You begin to implement those small tests of change, and then you can actually see the way in which those improvements spread out over time. So coming back in our last 5 minutes or so before we break into groups, coming back to some of these roles and functions of intermediaries, I just want to spend a little bit of time. I've given you the framework, sort of from the implementation frameworks, about some of the ways in which intermediaries might be able to help what you're doing in your local jurisdiction. I'm going to talk a little bit about some specific activities. So when we look at consultation and technical assistance, some of the types of things that intermediaries might do are things like one of our earlier seminars was that needs assessment. Maybe you don't have the expertise within your state government, within your local jurisdiction, within your local organization, and you might turn to an intermediary to look at, help us conduct this needs assessment. Where might you find these intermediaries if you don't have one? Well, they often grow in university settings. They grow in nonprofit settings. They tend to have folks who have a specific expertise around providing technical assistance, around having worked within systems of care, around having implemented evidence-based practices. Part of the research that we did when we conducted our survey of intermediaries is we asked folks how they developed. And a lot of intermediaries developed around a specific initiative where there was some additional funding or a specific goal to implement an evidence-based practice. Sometimes it happened around some legislation. And sometimes, it happened around the goal to be a purveyor of a specific evidence-based practice. So they could grow from different areas, and they can grow organically depending upon what the needs of the local community are. Intermediaries don't have to do all of these things, but they could provide the functions and support that are most helpful. So when you look back at some of these consultation technical assistance activities, engaging the community, helping with the, assessing needs, selection of practices, building those capacities, building relationships, incredibly important. One of the things that I have found over time is that as I have worked in intermediaries, the more I do the work, the more I gain the trust of community members, the more successful that we are. So those relationships are really key. When we're looking specifically about this role of intermediaries and helping facilitate the implementation of evidence-based practices, a lot of the things that don't come naturally to the local provider community or to funders or even to university treatment developers who might be really good at developing the model and developing a structure for delivering the model, intermediaries can really help in terms of thinking about things like, how do we bridge that gap? How do we get from here to there? What kinds of features do we need to support the successful implementation of the evidence-based practice? Everything from those beginning stages to conducting the training, providing ongoing coaching. How do we monitor fidelity? How do we use data to support that process? And then ultimately, how do we make sure that it sticks? How do we make sure that we can sustain the practice over time? I do want to note in here, one of the things I talked about was local adaptation. This is always something that people get nervous about, particularly folks who are, purveyors of evidence-based practice. And, when we talk about adaptation, we're talking about adaptation with fidelity to the model. So, how can we do things to make the model work in a local setting, in an adaptation that makes work? We've talked about that we'll talk about that in more depth in other seminars, but this is an important role of an intermediary to help the local constituents think about that. And then quality improvement, which many of you also said was a really important thing that would be helpful to you, really thinking about how we look at whether or not what we're doing is being delivered with quality and with fidelity. And we have lots of tools for doing that. But one of the biggest things that I try and impart to people is that quality improvement is something that we do in an ongoing way. It's not something that you do and then you walk away. It's something that you begin at the beginning of the process. You develop a structure so that a continuous quality improvement can continue over time. And one of the biggest things about using data is that it doesn't go into a black hole. All of us have participated in projects where we're filling out surveys, we're having to, spend time providing feedback, and nothing comes of it. And there's nothing more frustrating. I always tell my team, every single thing that we ask a provider to do should be relevant to them. We should be able to give them something back in a very quick time frame that's going to be useful to them to help them do their work better. So, data is only useful if it's useful to that end user and ultimately to the families that we serve. And that's really the goal that we try and keep in mind. And then we're also, can be involved in research and evaluation. Some of my partners on this call have been involved in a variety of different research projects. And, after we've had the opportunity to work with systems of care, implement those models of care, we also have the opportunity to look at outcome data, sometimes even engage in randomized controlled trials, or look at our implementation process through implementation research. And the funding for this can come from a variety of sources, both federal, state, foundation sources. But having that research and evaluation capacity with an intermediary is very helpful, and often part of what we're called to do. If you have an intermediary that doesn't have that capacity, a really great thing that you could do is join with other university partners who may have that capacity. And so that's a way to develop partnerships to compensate for areas that you may not have as developed. And then finally, in my last minute or so, I want to talk a little bit about policy and systems development. And I found a really interesting thing when I did that research years ago, and it's really held true over the years with lots of the conversations that I've had. And that is that when anyone gets into this business of working in this intermediary role, they usually don't start off by thinking about policy and systems development. That's really something that happens over time. And it's an outgrowth really of the idea of sustainability. So as we're working with systems to improve practices, to implement quality improvement systems, to try and create sustainable change, one of the things that the system recognizes, and certainly we recognize as intermediaries, if you don't have the policies in place and the appropriate systems in place to sustain those improved models of care, they're going to go away. So over time, a lot of the work that I've gotten involved in has been more engaged at both the local, state, and even national policy systems development level to think about those policies that can actually support and sustain best practices for children and families in communities. And then finally, it's also important for people to understand the value of what we're doing in your community. So there's lots of ways that intermediaries can work with you to engage in public awareness through reports and publications and presentations, local community forums, and engaging stakeholders, both on a small level and a greater level. It's really important for us to be able to talk about the value of what we're doing and to be able to talk about it in a way that's relatable and useful to other people. So all these things fit together, the TA work, the QI work, the use of data, they all pull together in terms of intermediaries working with local systems to help them reach good outcomes. We're going to break into some discussion groups in a minute. I'm not sure, we'll probably have fairly small groups, which will hopefully allow for some good discussion. We'll come back and summarize. I know you all might be in different places. You may have an intermediary in your community, you may not. You may be interested in developing one or perhaps working with an existing one. These are some of the issues you can explore in your breakout. But we're going to break you out into small groups now. Also, please identify any questions you have in your breakout, and we could bring them back for our Q&A at the end of this session. So we can go ahead and do that breakout now. All right, we're just waiting for folks to come back into the large group. We want to make sure that we have a little bit of time at the end for Q&A. So Jill, do you want to go ahead and jump in and get started and give us a little summary of a couple of the key points that your group discussed?
Yeah, sure. I'd say our group kind of focused on some of the challenges faced by intermediaries and working with partners and forming partnerships, and at the very core of it, just working with providers and agencies and systems that don't necessarily value EBPs, or see what value that could bring to them. So just the buy-in, and then once you kind of get beyond the buy-in to just the practice itself, the buy-ins for the sake of data collection required and the fidelity infrastructure that might be needed to implement, et cetera, et cetera. So, and also that relationships are very important often to being effective, and having strong partnerships between intermediaries and other organizations, but that can't be, that's not necessarily sustainable to have just a relationship be kind of a core linkage. So it's got to be more. I'd say that was the crux of our discussion, although Peggy could always jump in.
Great. Thank you, Jill. Sue, do you want to go ahead?
Sure. I felt like our time went really fast. Our group was really comprised of individuals that don't work necessarily in intermediary organizations, but work within organizations that might take advantage of working with an intermediary. So we approached our questions from that direction. And really the biggest theme that our group got excited about talking about is the idea of kind of how intermediary organizations can play a really helpful role in addressing resistance to change that might be occurring at an agency level. And so kind of what that independent voice can add and lend to kind of unlocking some of the perceived challenges to making changes. I think that was sort of our biggest theme. I don't know if anyone from our group had anything else to add. You can throw it into chat, but I think that kind of summarized most of where we got to in our conversation.
Great, thanks, Sue. Jesse.
Yeah, I love Sue's characterization of folks who are working in intermediary and then people who are sort of taking advantage of what an intermediary offers. Our group was made of the same sort of mix. And so those who were working on, becoming an intermediary had really the question about scoping out the work, like how do you identify the required capacities and then putting the resources to that, necessary scope of work, and how do you leverage different kinds of resources to make sure you're well supported. So, and we had some resource parents from our own state of Maryland who are spoke up, and they're able to benefit for. I think we talked. I just offered a little bit about how we do partner with resource parents here in Maryland for training and capacity building. So that's one of the functions we offer.
Yeah, we actually had some folks from Maryland in our group too that I directed your way. So we actually, interesting, had a lot of the similar discussion. We had a couple folks who just talked about needing someone to talk to when these sort of change mandates come through. Folks who are in the trenches, working in child welfare, in a local office, maybe a small office, and they kind of get a mandate that, hey, there's yet another change, and not having the resources or support of, being able to call someone or pull someone in or get the necessary consultation or technical assistance that they need to make it work. And I think in many ways, as we pull this back and think about the broader context, we've been talking a lot about change in systems, particularly child welfare, within the context of the Family First and Prevention Act. And when we think about, what we're asking systems to do, it's a really important message for those policymakers, for the funders, for the folks that are working in the capacity of trying to facilitate and implement these major changes, that we need to invest in that infrastructure to make the change happen. It's not enough to just say, do it. It's not enough to just have an expectation that the local folks are going to be able to get on board and make that change. But we have to both create the time and space for the change, and then we also have to provide the adequate support to make the change happen. And I think that's something that I kind of heard in all of these comments. So hopefully from our words to those who are making those decisions, we'll think a bit about that. I do want to say we're happy to answer any questions you may have in the last 5 minutes. If any of you have specific questions about building an intermediary in jurisdiction or challenges that you're facing with your intermediary, or other questions that came out of the discussion today, please reach out to any one of us. We're happy to talk with you about that. And while, if anyone wants to jump into chat with a question, I'll also share a couple other slides. So I listed here a bunch of references. We'll be happy to share those with folks that detail some of the information that I presented on today. The most recent article that I had written back in 2017 on this topic does talk about some of the strategies for developing intermediary organizations. So you might find that useful. Please feel free to reach out to me with any questions that you may have. Our next workshop is going to be September 16th, and we're going to be talking about the high quality implementation of EBPs at scale and how we support practice change at every level. So it'll be a continuation of this conversation. We're really happy that all of you can join us today. So let me just see if there's any share resource list again. We'll happily do that. There you go. And we can also certainly send that to you, or you can email me if you have any questions. There's also a survey in the chat. If you'd be interested in taking the quick survey, if anyone has any lingering questions, please feel free to reach out to us by email. Sue or Jesse, any final comments before we jump off?
No, none from me.
Okay, great. All right.
No, I don't think so. Thanks.
Well, we hope you all join us again for the next in our series coming up in September, and we hope you all enjoy the end of your summer. And thank you so much for joining us today.